right, well, good afternoon, everyone, and thank you for joining us for today's media briefing. As usual, Dr. Ferrer will give us a situational update on COVID-19 in LA County. We will then take your questions, and then that'll be followed by remarks in Spanish, and that will begin around 3 o'clock. If you have questions for Dr. Ferrer, please click on the hand icon that's in the participant panel on the right side of your screen. That will put you into our queue. With that, I'll turn things over to the Director of Public Health, Dr. Barbara Ferrer.
Yeah, thanks a lot, Tim, and thank you for joining me for today's briefing. This afternoon, I'll be talking about case, hospitalization, and death trends by vaccination status, race and ethnicity, and age group. I'll provide an update on our variant data. I'll also provide an update on community outbreaks, school cases and outbreaks, review our vaccination progress, and share a timeline showing some upcoming deadlines associated with vaccination requirements. I'll take the first slide.
Dr. Ferrer, I don't know if you can hear me, but we're having some technical difficulties. So for those media who are saying that they can't hear, it's a common issue. So give us 1 minute while we try to diagnose it.
Can you hear me?
Yes, I got you now.
All right, great, thank you.
Welcome back, Dr. Ferrer. So we lost your audio right when we went to the first slide, so maybe we want to start there. And you're muted still.
Perfect. Thanks so much. And sorry about that, folks. We're sad to report 28 additional deaths today. At least 22 of the people who died had underlying health conditions, and this does bring the total number of deaths to 26,106 in LA County. Our hearts and thoughts are with those of you who have lost friends and loved ones during this most difficult time. We're reporting 1,535 new cases today. That brings the total number of cases in LA County to 1,459,182. To date, more than 8.6 million people have been tested and had test results reported in LA County. Our test positivity rate is 1.7%, and this is a small increase from last week's same-day rate of 1.5%. Our daily average case rate with this 3-day lag is now 11 cases per 100,000 people. This is a small decrease from last week's case rate of 12 cases per 100,000 people. And our weekly case rate is 76 new cases per 100,000 residents, reflecting continued substantial transmission across the county. There are 871 people currently hospitalized with COVID-19. This is a decrease of 120 people over this past week. We have 211 open outbreak investigations at residential congregate settings and non-residential settings where there's at least one confirmed case of COVID-19. We'll take the next slide. This graph shows the trends in cases, hospitalizations, and deaths across the county from the beginning of the pandemic through September 22nd of this year. And note that this data is based on episode dates and therefore it lags behind the information that we're using to calculate the daily case rates. There's an interesting pattern that we're seeing in the latest surge when we compare with the summer surge of last year. During that last year's summer surge, our daily average cases peaked at around 2,800, while this year our cases peaked at about 17% higher, a little above 3,300. However, while our daily average confirmed hospitalizations peaked at 2,200 last year, this year's hospitalization peak was actually 20% lower at about 1,700. And peak average deaths fell 32% from 44 last summer to 30 this summer. This pattern of more infections but less severe and fatal illness is likely due to the highly infectious Delta variant and the ability of vaccines to blunt serious illness and death. And while we're glad for the lower death rates this year, these are largely preventable deaths, and they remain a tragic reminder of this virus's destructive potential, particularly among those unvaccinated. Next slide. This slide shows cases and hospitalizations over the same period as the previous slide, but it's now sorted by vaccination status. Here, the dotted lines represent outcomes in unvaccinated people, while the solid lines represent outcomes among those who have been vaccinated. And you can see, looking at the dotted green and orange lines, during our latest surge, unvaccinated people accounted for the majority of the cases and the hospitalizations. As of September 18th, unvaccinated people were twice as likely to be infected and 3 times as likely to be hospitalized as vaccinated people across the county. Next slide. You'll also see deaths by vaccination on this slide, again with dotted lines representing outcomes in unvaccinated people and solid lines representing outcomes in vaccinated people. On September 18th, 4 times as many deaths were occurring among those unvaccinated than those who were vaccinated. Next slide. Following outcomes among fully vaccinated people allows us to see the full scale of the vaccine's protection. Here you see the number of cases, hospitalizations, and deaths among fully vaccinated people to scale. The large green box represents the nearly 5.6 million residents that are now fully vaccinated. The tiny purple box in the left lower corner of this green box represents the 55,259 fully vaccinated people who have tested positive for COVID as of September 28th. In all, about 1% of fully vaccinated people in LA County have tested positive. Of those who tested positive, 1,884 were hospitalized, up from 1,732 the week prior. This translates to 0.03% of all fully vaccinated people ending up hospitalized. Deaths in this group over this interval also increased slightly, from 229 to 257. Translating to 0.005% of fully vaccinated people passing away. These numbers continue to show that fully vaccinated people remain very protected from the worst outcomes of the infection with this virus. and this is driving our urgency to reach as many residents as possible with these highly effective vaccines. Next slide. This table shows case and hospitalization rates by vaccination status, sorted by race and ethnicity, as well as age group. In addition, you can see what we call rate ratios in blue. These are the results when you divide the outcome rates among unvaccinated groups by the outcome rates among those vaccinated. And you can see that unvaccinated Black and Latinx people had the highest case rates over this period, with 687 to 708 new cases per 100,000 people in these groups. Across all racial and ethnic groups, infection rates among unvaccinated people were 2 to 3 times higher than among vaccinated people. And if you look at the case rates by age group, you'll see that teens, aged 12 to 17, had both the lowest case rates among their vaccinated members and the highest case rate among their unvaccinated members, indicating that vaccines are particularly powerful protection for people in this age group, decreasing the rate of infection nearly 9-fold. If you look now at hospitalizations of all racial groups listed here, Black residents had the highest hospitalization rates among both vaccinated and unvaccinated people. However, you can also see that the rate ratio for hospitalization in Black residents was about 4, and that's lower than the ratio among Latinx, white, and Asian residents, for whom it was closer to 6. This difference may be the result of members in Black communities having higher rates of underlying conditions that put them at severe risk for COVID illness. These higher rates of underlying illness reflect decades of gaps in access to the resources that support optimal health. Looking at hospitalization rates by age, you can see the larger rate ratios here. In all of these groups, unvaccinated people are 15 to more than 20 times likelier to be hospitalized than their counterparts. For those with doubts or questions about whether vaccines still offer robust protection against the worst outcomes of COVID infection, these numbers, which represent the lives of our LA County friends and loved ones, should offer us all an unequivocal yes. We note that hospitalization rates are highest among older adults, regardless of vaccination status, and unvaccinated residents in this age group were 15 times more likely to be hospitalized than those that were vaccinated. Although hospitalization is much less common in younger adults, the protective effect of the vaccine is particularly noticeable among 18 to 49-year-olds, where those unvaccinated were 21 times more likely to be hospitalized than those vaccinated in this age group. As we approach cooler weather and the accompanied increased risk of disease spread, these numbers serve as a reminder about the importance of remaining focused on bringing the vaccine to those that are unvaccinated, especially those with risk factors associated with social and economic inequities that we know increase their risk of severe illness. Next slide. Delta still comprises 100% of all of the variants sequenced by our public health lab, crowding out all the other variants that we have seen to date. The CDC doesn't consider the Mu or the Lambda variants to be variants of concern. They now consider the Mu variant to be a variant that's being monitored, indicating that it's thought to not pose significant risks at the moment to the U.S. public health. The World Health Organization, however, does identify both Lambda and Mu as variants of interest because they've been associated with significant community transmission or multiple COVID-19 clusters. We therefore are continuing to gather data on the distribution of these variants among both new and historic samples. This week, we're reporting 19 Mu variants that were newly identified from samples taken previously from LA County residents, for a total now of 269 cases linked to the Mu variants. Only 7 of the Mu cases identified were from after August 15th of this year, as you can see, a handful of them over the early weeks in September. And we haven't identified any new Lambda variants in the past weeks, leaving our total number of Lambda cases identified as 28. We're going to continue to provide these regular updates on variant trends among LA County residents. Next slide. With our concern high for Delta variant related outbreaks, especially among vulnerable populations in healthcare and residential settings, We've been monitoring these settings closely for outbreaks. And here you're seeing the outbreak trends from the early days of the pandemic through September 25th of this year. As you can see, the highest numbers of outbreaks over the last few months have been in settings serving people experiencing homelessness. Meanwhile, outbreaks at skilled nursing facilities, other long-term care facilities, and healthcare settings, where vaccination rates are relatively high, have remained relatively low. These differences are, again, real-time evidence that the vaccines do provide protection among our most vulnerable residents. Thank you. We'll go to the next slide. We're also monitoring outbreaks at a variety of work sites. As you can see here, over the last few months, our highest numbers of outbreaks have been in accommodation and food service settings, with elevated numbers as well in retail, manufacturing, transport, and warehouse settings. The numbers of these outbreaks have fallen significantly as community case rates have decreased. Next slide. In addition to monitoring outbreaks in a variety of occupational and work settings, we of course continue to closely follow disease transmission at schools. On this slide, you see staff and student cases and close contacts represented by trend lines. Most of these cases are diagnosed through routine screening of asymptomatic cases, which identifies many infected people that would not ordinarily be detected. The lines and shades of pink represent cases, while lines and shades of green represent close contacts. Darker shades are representing students, while lighter shades represent staff. And please note, because the numbers of student close contacts are so much higher than the other metrics on this slide, we've plotted them on a different y-axis that you can see on the right of the slide. Weekly student cases that are represented by the dark pink line increased in August from to a peak of nearly 2,800 cases the week ended August 22nd. The dark green line, which represents the number of student close contacts, rose correspondingly to a peak of about 11,000 close contacts by the end of August. Both student cases and contacts have since decreased substantially. Last week, we saw a total of 829 student cases, and we saw about 3,100 student close contacts. Staff numbers also decreased weekly from their high point in mid-August. Last week, we saw 109 staff cases and only 26 staff close contacts. The efforts of our school communities to put in place mitigation strategies that are protecting student and staff are the primary reason we're seeing these downward trends. And we're grateful for their hard work that makes it possible for schools to be open safely for in-person learning. Next slide. Although most of our K-12 cases obviously are not associated with outbreaks, 3 or more cases that are linked to transmission at a school site are considered to be part of a school outbreak. And we meet those with additional resources that are dedicated to investigating and stopping transmission among students, staff, and communities. While our overall case numbers in schools are trending downward, the number of outbreaks increased slightly over the last few weeks. And we're from 11 outbreaks actually last week, or the week of September 18th for the week ending September 18th, to what we're seeing now as 12 outbreaks for the week that ended September 25th. Youth sports are accounting for most of the outbreaks, although we're also seeing outbreaks in elementary, middle, and high schools. These numbers are amazingly low, given that 3,000 plus schools are now open countywide. Next slide. The slide is just really documenting the cases and the close contacts that end up being linked to the outbreaks that we showed you on the previous slide. You can see that student cases involved in outbreaks, those are represented in dark pink, have fluctuated since the last week of August, and they reached a total of about 102 cases last week. Meanwhile, the number of student close contacts related to outbreaks, again, that's represented in the dark green, decreased by about 2/3 over the past 2 weeks. This can reflect both modified the availability at some schools for them to use the modified quarantine, but also the fact that there are more rigorous processes in place at schools for being able to identify those close contacts. I just want to note that over the same interval, we've seen 5 or fewer staff cases and close contacts linked to outbreaks. Since the outbreaks taking place in the last week may still be open and under investigation, the numbers of students and staff affected in the more recent outbreaks represented here can still increase. Next slide. With cases declining in schools and communities, we can focus on increasing vaccination rates as quickly as possible to avoid the disruption that would come with future waves of infection. As of September 26th, 92% of LA County residents 65 and over have received at least one dose of the vaccine, as have 78% of residents 16 and over and 77% of residents 12 and over. 69% of residents 12 and over are now fully vaccinated. 67% of LA County teens between the ages of 12 and 17 have received at least one dose, and 59% are fully vaccinated. Out of all of our nearly 10.3 million LA County residents, that includes those not yet eligible for a vaccine, 66% received at least one dose and 59% are fully vaccinated. Last Friday, September 24th, we began administering booster doses, as well as the additional doses we've been administering to immunocompromised people. Countywide, a total of nearly 105,930 third doses have been administered by LA County providers. Most of those doses have gone to people who are immunocompromised. While these overall numbers are impressive, millions of eligible residents remain unvaccinated. Next slide. We do look at this chart every single week, and we've seen over the past few weeks, vaccination rates have plateaued, but not at the high levels we need to combat transmission this winter. Between September 20th and the 26th, we administered about 38,000 doses across the entire county network. And this number is going to increase by a few thousand once all the reporting is complete. But despite our very best efforts, the vaccination progress is going much more slowly than we need it to be. Although booster shots are getting a lot of media attention, it's still most important to increase our numbers of first dose recipients. Getting our entire community vaccinated is perhaps the best way to acknowledge how profoundly connected we are to each other for our individual and collective well-being during this pandemic. Next slide. And the importance of our obligations to each other are brought out in stark relief in this slide, which reminds us how much work we need to do to close vaccination gaps among younger members of Black and Brown communities. On this slide, subgroups with vaccination levels below 60% are noted by numbers shown in red, while the remainder are in white. This week, we're noting with some relief that 60% of Latinx adults aged 30 to 49 are now vaccinated, moving them from red to white. While this age group, with this age group representing so many workers who provide and care for young families and who comprise the essential workforce of so many industries in our county, we're reassured to see vaccination increasing in this group, and we're hopeful that other young people will similarly show up to protect themselves and each other. Next slide. We continue to send hundreds of mobile vaccination teams into the neighborhoods where unvaccinated people live and work so that we can administer first, second, and third doses of vaccines at places that are very convenient. And as you can see on this map, 95% of our mobile unit visits scheduled this week will be offering Pfizer vaccines, and that includes vaccines for the Pfizer booster. Those are the sites that are marked in orange, while the sites not offering Pfizer are marked in blue, and there's hardly any of them. Our mobile teams are focusing on getting vaccinations into neighborhood gathering places, especially in our county's highest need areas. And anyone, as a reminder, can request a mobile team on our website to come to a community spot or a work site near you. Next slide. Many of our fixed sites are also focused in the highest need areas of our county, and you can see that on these maps in the sections that are in pale green. Across the county, not all of our sites are set up to manage the cold chain requirements of the Pfizer vaccines. Only 53% of our fixed sites, and those are marked in orange, are offering Pfizer vaccines, and that includes the boosters. While about 629 of them, marked in blue, are not offering Pfizer vaccines. This is why it's important, if you're looking for a booster, to go onto the website and make sure you're going to a place that's able to offer the Pfizer vaccines. Over the coming weeks, our mobile teams are going to be targeting communities with limited access to Pfizer doses to ensure that access to boosters is as easy as it can be across the entire county. As a reminder for anybody who needs help scheduling an appointment, getting free transportation to a vaccination site, or getting answers to questions, you can call the DPH call center at 833-540-0473 for assistance 7 days a week between 8 a.m. and 8:30 p.m. Next slide. With a variety of vaccination verification requirements affecting LA County residents, this timeline tries to summarize the important upcoming dates. Except where specified, these are all dates when requirements to verify full vaccination status go into effect. As of September 20th, self-attestation is no longer a substitute for proof of vaccination status or a negative test result at indoor events in LA County that have more than 1,000 attendees. Today, September 30th, is the deadline for healthcare and home care workers across LA County to be fully vaccinated, while LA County employees have until October 1st and LA City employees until October 5th. On October 7th, proof of full vaccination or a negative test result will be required to enter outdoor mega events. These are events with more than 10,000 people, and proof of at least one dose of the vaccine will be required to enter or work in indoor portions of bars, lounges, nightclubs, breweries, wineries, and distilleries across LA County. On November 4th, bars and similar establishments throughout LA County will be required to verify full vaccination of all patrons and employees prior to entry to indoor portions of their establishments. Similar requirements will go into effect on the same day in West Hollywood. The LA City Council will be voting on an ordinance next week that would extend vaccination verification requirements to additional indoor establishments in LA City, including fitness centers, personal care establishments, entertainment venues, and restaurants. The anticipated date of implementation would also be November 4th. Under a state order, TK through 12, grades 12, school staff across the county are required to be vaccinated by October 15th, or the test weekly. LAUSD students participating in extracurricular activities must be fully vaccinated by October 31st, and Culver City students are required to be vaccinated by November 19th. All LAUSD students 12 and over must be fully vaccinated by December 19th. And we're aware that the governor has indicated that the state is reviewing potential vaccination requirements for older students across the state that would then apply, of course, in LA County. There are also federal requirements, including President Biden's executive order requiring federal workers to be fully vaccinated by November 22nd. And earlier this week, the state issued a new health officer order requiring workers in adult and senior care facilities and home direct care settings to be fully vaccinated by November 30th. As we go through the next couple of months, helping organizations and establishments comply with vaccination requirements will be a focus for our public health teams. We continue to see high rates of compliance with other safety measures, and we anticipate similar cooperation with our businesses and our workers with the implementation of vaccination verification requirements. Next slide. Targeted vaccination, we can go to the next slide. Yeah, great. Targeted vaccination requirements are a critical strategy for keeping people safe, and they have a lot in common with many other public health measures that are employed to protect people from harm. One example that comes to mind are the rules we make about smoking around other people. Smoking is hazardous both to the health of smokers and to those around them exposed to secondhand smoke. And in many cases, without rules to prevent people from smoking in certain places, others would have no control over whether they're exposed to cigarette smoke or not. So we do have rules in place to protect everyone from exposure to secondhand smoke. California has forbidden smoking in most public places since 1998. Smoking is legal and people can still smoke, but we have for decades agreed it's unacceptable for the risks taken on by smokers to be shared by others who happen to be sharing their airspace. Targeted vaccination mandates are similar. We have ample evidence showing that being unvaccinated for COVID increases the risk to your health and increases the health risk you pose to others by raising your potential for transmitting the virus onward and for dangerous mutations to emerge. And while there's no requirement that everyone must be vaccinated, These targeted mandates communicate that it's not acceptable for the risk taken on by unvaccinated people to be shared by others who happen to be sharing their space in particular settings. While we can't reduce the risk of virus transmission to zero, all of our efforts need to be focused on reducing the risk to a smaller number as possible. I can understand that vaccination mandates feel like a form of judgment or coercion, the same way no smoking signs might make a smoker feel angry. I hope that everyone can understand that this is not the intent. Unvaccinated people are unfortunately more likely to get infected and to be able to spread the virus, which is transmitted through the air. Most current hospitalizations and deaths are among unvaccinated persons. The goal of these mandates is to reduce the risk to keep everyone safe while moving us as quickly as possible to the end of the pandemic. Thank you, and now I'll take your questions.
As a reminder, if you want to be put into the queue to ask Dr. Ferrer a question, please click on the hand icon that's in your participant panel, or you can send me, the host, a chat, and I can add you manually. Our first question, Dr. Ferrer, will come from Claudia Pescuda with KNX.
I knew you were going to come to me first. I was working on it. Okay. So does it surprise you at this point that Delta remains dominant to the point that it's crowding out everything else? And what does that say to you? And then given a number of factors, the fact that Delta is widespread, the vaccination rate among homeless people is relatively low. As the Times reported today, vaccination rates among sanitation workers are low. And you pointed out that we're seeing the highest outbreak rates in homeless settings and for congregate settings. What concerns do you have about the encampment cleanups that are happening right now? And, do you think that they should continue as they are, or is that something we should hold off on? And then last week, you had mentioned that unvaccinated white people had the highest death rate. And I'm wondering if you have any idea why that might be. Thank you.
Yeah, thanks so much, Claudia, for these questions. In terms of the Delta variant remaining dominant, it's highly infectious, and that's why it crowds everything else out. And it obviously, continues to crowd everything out. It doesn't mean it always will. Almost all of our surges, have been associated with a dominant strain of the virus. And, we're coming out of this last surge. So there are, of course, possibilities when we have less transmission for us to see a different virus sort of overtake Delta, but that hasn't happened yet anywhere in this country. So there are places, though, of course, around the world where we do see other strains popping up, and that's why we continue to track that and report that. As a reminder, the Delta variant was first noticed as becoming the most dominant variant in India. So helps us all to pay attention to what's happening in the world. And our biggest concern and our most important strategy for working with people who are experiencing homelessness is to try to increase the vaccination rates. That offers the most protection for the individual people who are experiencing homelessness and for the community at large. We don't really have any particular concerns about the cleanups. I know everybody is working hard to be respectful. We obviously coordinate so that if we're in the middle of outbreak investigations, those cleanups are delayed a couple of days in order for us to be able to reach all the people we need to reach, to make sure that they're informed about the needs for quarantine and isolation. But it is also important for cleanups to happen. And so we'll work closely with everybody that's involved, the cities, obviously, the organizations serving people experiencing homelessness and with people experiencing homelessness to make sure that nothing here is really exacerbating either the spread of the virus or putting people at greater risk. But the best way for us to help everybody right now is for us to be able to get more people vaccinated, including more people experiencing homelessness. And then I don't have the numbers in front of me on the highest death rates this week. I don't think they've changed much from last week. And again, the vulnerability of people who end up hospitalized and then unfortunately and tragically who pass away, as you can see, is very much related to being of older age. And in fact, with the data that I share every month with underlying health conditions that often go along with being of older age. And so one of the explanations, obviously, for the disconnect, or not the disconnect, for the higher death rates amongst people who are white would be to look at that data stratified by age and by underlying health conditions, because I'm sure that those are both two very important contributing factors, as they are with all deaths. But in fact, it may be that there are larger numbers among white people who are passing away who end up being older, and that may help explain why their rate looks higher. It's not an age-adjusted rate, which would, try to account for that. So thanks for that, and again, we'll be reporting back out on that probably next week or the week after, looking at sort of deaths more intentionally and noting where we've done medical record reviews, what else we're finding out about those. So thanks, and we'll go on to the next question.
We'll go next to Patrick Healy with NBC News.
Hello, Dr. Ferrer. Given that today's the deadline for the healthcare workers statewide, a broad swath of them to finish getting their doses, have you heard anything from your friends over at DHS about whether or not we have a significant number of county healthcare workers still yet to be vaccinated, and might they face termination if they have not gotten vaccinated today? And then a second question. The proposed LA City vaccination ordinance for the public places, non-essential public places, is much broader than the county's health order. Do you see a need to reconcile the two so that we don't have rules when you walk across the street? Thank you.
Yeah, thanks so much for both questions. I don't have the exact numbers for DHS. I want to also acknowledge that we have healthcare workers at the Department of Public Health that also have to be vaccinated today, fully vaccinated or have an exemption. I know that our compliance rates are super high, and I think DHS's are as well, but you'd have to contact them for the exact number, and that we're working as fast as we can to make sure that all of the covered healthcare workers in the county are in fact in compliance with that health officer order. I know that, as of late last night for DPH, our number was over 90%. So we do not have large numbers of people that are not fully vaccinated. And again, we'll be working with those that are not fully vaccinated to make sure that they're not violating the health officer order. And that is not by terminating people. We'll be working with them to come into compliance, and while they're coming into compliance, either getting that exemption or getting fully vaccinated, there will be some alternative assignments that they will be helping us with. There's lots of work, of course, across the county, but our hope is that these are really, really high rates. We're hearing from other hospitals and healthcare systems that they too have been very successful in getting the vast majority of their healthcare workforce vaccinated. And, again, huge shout out to the healthcare workforce. They've been on the front lines from day one. They've saved, thousands and thousands of lives with their dedication and their skill. And as you can see, the vast majority of them are also continuing to protect other people by being able to do their jobs while they're fully vaccinated. So I want to just really thank everyone for doing their part here. And in terms of the alignment between the city's ordinance, which may be passing as early as next week, we're very excited about the actions that the City Council is taking to add layers of protection in the city of LA. We'll be working closely, obviously, to provide support to all of the establishments that will be covered by their ordinance. And again, working to make sure that that implementation goes as smoothly as possible. I want to note that the county health officer order, which was more limited in scope, also is going into effect earlier. And really what we did there is we looked at the highest risk, the very highest risk settings, and wanted to move quickly there. But we're obviously full support of the city and with other cities that are moving forward with safety measures that are more targeted than what the county has done. And we'll be, looking at all of the data as we move forward on our recovery journey and making decisions about what's best for us to do with county health officer orders. I want to be, really supportive as well, not just of cities that are moving to provide protections, these layers of protections, and that means, dedicating city resources to that implementation process. But I want to thank all the businesses that are doing this as well. You don't always need a health officer order to do what's right. You can look at the conditions at your workplaces. You can work with your employees and your managers and make, at this point, informed decisions about how to offer those layers of protection. We don't have capacity limits. We don't have distancing requirements. And yet many places are still being super careful about not creating overcrowded conditions, about having spacing and distancing, and as you all know, adding requirements around vaccination and testing. So I want to also applaud all of those businesses. But thanks for that. We'll go on to the next question.
And that'll come from Ron Lynn with the LA Times.
Hi, Dr. Ferrer. Thanks for taking our questions. Our questions today are on hospitalization rates by geography, the length of the mask mandate, and just some clarifications on theme parks and the flu. First, earlier this summer, there was chatter about how some West Side areas like Beverly Hills have seen among the county's higher case rates as compared to the county-wide rate, while some places that have higher case rates in the past, like the East Side, were not hit as hard this summer. Do we know if hospitalization and death rates in places like Beverly Hills were higher, and hospitalization and death rates on the East Side were lower? Second, Dr. Davis at last week's town hall forum mentioned that the county would want to wait until the county falls into moderate community transmission levels before considering ending an indoor mask mandate. Can you elaborate on what criteria you'd use before lifting the indoor mask mandate? Third, and these two are just clarification questions. On outdoor mega events, do people need to be fully vaccinated or just have one dose starting October 7th? The order itself says full vaccination, but I think on the chart that you showed today, it just says one dose. And finally, we know flu vaccinations are a big priority this year, but just so we can compare the scale of flu deaths versus COVID deaths, have you been able to release how many people died from the flu in the last pre-pandemic flu season of 2019 and to 2020? Thanks.
Yeah, thanks so much for the questions. Let me just do flu first. I don't have the data. I don't have the number handy. We do have an estimate. I want to note that flu is not tracked with the same rigor as COVID is. So the numbers, we just have to take that into account. But it's a relatively low number, and we'll get that to you. Much, much lower than the number of deaths we've experienced from COVID. And I'm going back not to the COVID year, but the pre-COVID year. But we'll get that number to you. Off the top of my head, I think it's under 2,000, but I don't want to be quoted on that because I'm not positive. So we'll just go ahead and get that number to you. And obviously, we're working really hard as well on making sure people are going in to get their flu vaccines this year, just like many people went in last year. We had higher rates of flu vaccination last year, and we're hoping that holds for this year as well. Clarifying on outdoor mega events. Sorry if there's confusion on the timeline. The outdoor mega events, it's a requirement on October 7th that you either are fully vaccinated or you have a negative test. Because at those mega events, you have the option for testing. It's either full vaccination on October 7th, or you need to have a negative test result. At bars, breweries, wineries, distilleries, nightclubs, and lounges, the requirement there is for your first dose and then your second dose by November 4th. In terms of the length of the mask mandate, so we've indicated from the beginning that when transmission was lower, we would be considering lifting the masking mandate. I think you ask an important question. There is a definition of low transmission and moderate transmission. We use CDC's transmission rubric and we share that with you often, that framework about when we get there. And it's right now it's based on a weekly case rate. We temper that by acknowledging that if we have variants of concern that are highly infectious, it might not be the appropriate time to go ahead and lift those mask mandates if you don't have a much higher coverage by vaccinations. But the most important measure that we're looking at is getting back to low transmission. Obviously, the lower the transmission, the less virus is circulating, the less chances we all have of either getting infected or infecting others. And it's in those settings that mask wearing, particularly if you have settings where people are fully vaccinated, may not be as important. Right now, still have a lot of transmission, still super important for people to wear their masks. We still have a lot of unvaccinated people as well. In terms of hospitalizations and the case rates, I don't have that data handy, but we do include, I believe, on the website now, and Ron, you can correct me if I'm wrong. I thought by community, you can now look at case rates, incidence case rates, death rates, and vaccination rates for the same communities, so that you're able to get some sense of what may be going on in those communities. I mean, we've noted from the start that with high transmission, there's a lot of vulnerability for lots of people, even those people who may be fully vaccinated. And that in some of the communities, people with more resources are able to take much more advantage of all of the reopenings and all of the activities that allow for a lot of intermingling. And that may, in fact, have contributed as well. I also want to note, and it's important to note, that one of the reasons why boosters have been approved is for people who are older, and those are the people who got vaccinated earlier on, and for people who have serious underlying health conditions. It is known now that there is a waning of protection from the vaccines that happens, typically sometime, around 6 months, where it's significant enough that we're asking people that they should consider getting that booster if they were vaccinated with Pfizer. So I think some of that plays in as well when you're looking at sort of the numbers of hospitalizations and the numbers of deaths. One of the things that we're working on is trying to age adjust some of this information, because that then accounts for the age distribution issue that sometimes gets masked with these unadjusted rates. But we should have more for you on that later. But I'm hoping you get sort of basic information on our website now, and you can let me know if you don't, and we'll try to get you some additional information then.
Do you have time for one last one, Dr. Ferrer? I know you're tight on time.
Yeah, we have time for one last question.
Okay, we'll go to Jackie Fortier with KPCC.
Yay. So your last answer transitioned really well into my question. How concerned are you about nursing home staff not having access to Moderna boosters? I mean, nobody has access to Moderna boosters right now. Are you afraid that we'll see, more cases or more outbreaks in nursing homes in the coming weeks, especially with workers not having a Moderna booster? Thank you.
Yeah, thanks so much, Jackie. And it's not just the workers, the vast majority of the residents in our skilled nursing facilities were vaccinated with Moderna. So I just want to make sure everybody knows that we have an effort out right now at the skilled nursing facilities to make sure that those residents and workers that were vaccinated with Pfizer are getting their booster doses. I mean, obviously it's their choice, but we want to make sure it's accessible, and we have teams out there offering the vaccines, but it's a super small number of residents and staff. It's, I think, under 2,500 residents. So again, it's not just an issue for residents, it's also an issue for staff. I want to note that I think when I last looked at the numbers, it's almost 89% of staff and residents are fully vaccinated at the skilled nursing facilities. And that's a number that really needs to get applauded. And it also, as we show, regularly here, really accounts for the fact that even during this last surge, while there always is an impact when there's more community transmission, relatively small impact at the skilled nursing facilities. And you saw with the data I showed today that the number of outbreaks is still remaining low. But we're anxious, as is everybody else, for the FDA and the CDC to review the data on Moderna and Johnson & Johnson and figure out whether or not there's waning protection there as well, because that would let us know if there's something to worry about. Until we get that evidence about waning protection, we want to reassure people that the vaccines, as you can see with our data, are providing a lot of protection against hospitalization and against dying, and even in our skilled nursing facilities, our numbers of new cases and outbreaks, and an outbreak there is one case, so our numbers of cases and outbreaks is extraordinarily low still, and we're hoping we'll be able to keep it there. We also, just as a reminder, there's lots of infection control practices that have been introduced, and we pay a lot of attention there. And when there is an outbreak, our team is out there immediately. Both our outbreak team and our health facilities inspectors to just make sure that we're doing everything we can to slow the spread at any sites where there are outbreaks. So thanks for that. And again, we'll close with a thank you to all of you. Deep appreciation for everything you're doing. I know there's a lot on the new vaccine verification requirements. We're trying to make it as simple as possible for people to understand when various obligations go into effect. And again, we urge people to go to our website for more in-depth information about what they can do. There's a great toolkit for businesses. And we have, of course, our lines where people can ask for and receive additional technical assistance from us. But with that, thanks, and we'll talk next week.
Great, thank you. If you, as always, if you have further questions, you can send them to media@ph.lacounty.gov, and we'll do our remarks in Spanish in about 5 minutes. Thank you.